talk about yeast infection, because I have been having a lot of questions about yeast infection and how to treat yeast infection, the drugs to treat yeast infection, why does it keep coming back, what to do so that it doesn't come back. Okay, and then sexual transmitted infection. So one thing you should understand in this video is that most women actually have sexual transmitted infection and they not yeast infection. They are thinking, because almost 99% of women, every woman suffers from yeast infection. Okay, so women now think that they are having yeast infection, not knowing that they are actually having any type of sexual transmitted infection. We could be gonorrhea, syphilis, chlamydia, So whenever you have discharge, so this is what you should know. If you've been treating yeast, you've treated yeast infection, they gave you over-the-counter cream and insertion, okay, and you've treated it, but it keeps reoccurring, then you might need to go and check if that is yeast infection or if you have sexual transmitted infection. That is the number one. Secondly, if the discharge is cottage cheese, I'll put a picture, cottage, okay, cheese, okay, that is a sign of yeast infection. But if it is just normal creamy, yellowish, smelly, yellowish, green, and that is a sign of another sexual transmitted infection. So briefly, let me talk about why yeast infection keeps coming back, so that when I tell you how to treat it, it doesn't come back. Number one, fingering. We neglect this a lot, okay? We women, we like it, right? Stop fingering. If you must, let it be neat. Make sure your partner washes their hands, okay? Because they put their hand up there, and from the surroundings of your vagina, or even from their hand, they push dirt and microorganism in there. It can cause yeast infection. Even if you've treated, it will keep reoccurring. Now, an important one, please, this doesn't concern this video, but it's very helpful. If you're treating yeast infection, if you're using creams or inserting yeast, anything you're using to treat yeast infection, if you have sex with it, that the chemicals in yeast, in those drugs, breaks the condom. Please be aware, sometimes it damages the condoms, okay, and it also makes it hard for the yeast to go. So if you're treating yeast infection, avoid having sex until the course of your treatment, until you're done, so that you don't even transfer the yeast, so that it doesn't keep coming, because the medication won't work effectively. The guys, the men, need to do better in helping their girlfriends prevent yeast infection, okay? Because if she keeps, these are the things that men do that give women yeast infection. Mind you, yeast infection is not sexually transmitted infection, I hope you know, but these are the things that men do that their wives keeps getting yeast infection. So please, men, be careful and stop doing this, and ladies too. Number one, fingering. Yes, fingering travels, pushes microorganisms inside the woman's vagina, and sets off the vagina and cause yeast infection, right? That's number one. So if you must finger, make sure your nails are trimmed and you wash your hands, so that microorganisms will be so much eliminated. Number two, not washing your penis and you're just jumping inside that place. No, you're transferring immediately. Immediately you're coming back from work, the lady has to bathe, but you guys don't bathe. You always feel that your soul needs. No, you remember you've peed though. You just carry the whole thing, the pee, everything, the heat, sweat, put inside that place. She will have infection. The infection will keep coming back. Okay, and you will think you're okay, but you're just coming back from work, you miss your wife, you just put the whole thing there. Please try to bathe. Another thing is your boxers. Okay, please try to change your boxers. Try to wash them, okay, because that place, trust me. Another one is what is it called? Shaving. Men, you need to trim that area, that place, no, in as much as it helps protect STD, but it has to be trimmed, because if you leave it so bushy like that, it gives room for microorganisms to thrive. And she's on top of you as she's grinding and doing whatever she's doing, microorganisms go in, she's taking the whole thing in. And the body of a woman is open. So these are the things that we will do to help protect these ladies, protect our women. Okay, please, we really need to do better. No, but if you must ask her to give you whatever head or whatever you guys do, please make sure that that place is clean. This will help her a lot in dealing with yeast infection. So let's get to other things that causes yeast infection for women. Now, or after treating the yeast infection, it keeps coming back, right? I've mentioned other ones in my other video. So the next one is this. Please, after treating yeast infection, try to discard your panties, get a new set, or if you don't want to discard them, iron them, wash them. After washing them, iron them, so that the heat from the iron is a form of this sterilization. The ironing will really help to kill, sterilize the pants. It will become almost like the new one if you don't have money for. Another one is douching. That is putting your hand in. Most people don't know what this douching is. It's putting your hand inside your vagina to wash. This thing will keep giving you infection, whether you like it or not. Don't do that. I tell people to wash your vulva, not your vagina. Vulva, you must wash it. Anybody that tells you that you don't wash it is a lie. You wash that outer part, because that place you're urinating, your urine is touching all of those places. The fluid is coming out, is touching. So you need to wash it with mild soap or dermatological proven fem wash. Okay, but it's outside, even your mons, where the hairs are, you wash it, but not inside. Don't put your hand. That is why during fingering, gives you that yeast infection. They are the same thing. So don't put water inside, don't put anything inside. Another thing is this yoni pills, pearls. This thing is very dangerous to you as a woman. I'll do that in a separate video, because it's like this, it's very big. So stop it if you're inserting yoni pills. Another thing is stop steaming your vagina. This thing it will give you reoccurring infection. Look for that video where I say women should stop steaming their vagina. Okay, I explained that, you understand. I don't want these videos to be so long. All right, that's about it. What next? Okay, as we go forward, then another one is make sure you finish the course of your of your drugs. Finish the drugs that they gave you to take. Okay, so let's get to then try to eat things that the vagina likes. For instance, things that has lactobacillus acidophilus in them, like yogurts, Greek yogurt, some yogurt that have active culture. Read it, you will see active culture. If they have active culture in them, they are good for you. Take fruits, take vegetables, take vitamin C. It helps you build your immune system so that you will not be, prone to this opportunistic this yeast infection all the time. Now let's get to how to treat yeast infection. Okay, drugs for yeast infection. Please, a disclaimer: make sure you always meet your doctor before you take any drug, or ask your doctor to prescribe drugs for you. These are over the counter. That is why I just mentioned them. However, if you're experiencing anything more than normal signs of yeast infection, please make sure you meet your doctor. So these drugs, I'm going to type them and post them on the screen here so that you will see them. However, there is this particular drug they call boric acid. Boric acid is used for complicated yeast infection. For complicated, this is not for just normal yeast infection. What is complicated yeast infection? Complicated yeast infection is yeast infection that you treat it, everything, you've done everything, you don't do all of these things I say, but it keeps coming back, like you're having yeast infection every month. It's a complicated yeast infection, and it has to be diagnosed with by your doctor. So if you keep treating, your yeast infection keeps coming back, and you're sure and certain that it is not sexual transmitted infection, please meet a doctor so that they will find out what is going on. So this is when they usually diagnose people of complicated yeast infection. So that is what boric acid is used for. Okay, so that you stop abusing this drug, so that when their need arises, unfortunately, they will not work again. Okay, so there are milder drugs for normal yeast infection, which are this one that is on this screen. Okay, however, please make sure you can get them over the counter. Okay, yeast infection drugs are over the counter. Okay, for women, you can get them over the counter. These are the drugs. There's one that you can insert, right? As I'm posting it here, I'm also going to post how you do them. And when you insert, there's one you just rub as a cream, depends on the one you want. But there's this major one, fluconazole. You take it depends on how it comes, how many milligram it comes. Okay, so you just go to the pharmacy and they will direct you what to do. Tell them you want this drug, any of them, for yeast infection, and they will tell you what to do. Please like this video, share, let me know if you have questions. Please make sure you subscribe. Okay.